Hi friends, once again welcome back to the Nurse channel. The most awaited nursing officer recruitment examination for the National Institute of Mental Health and Neuroscience, that is the NIMHANS, has come, and you know that the last date for the application is 18th of November. So whoever didn't apply for the post, kindly apply at the earliest. And the notification details and regarding the vacancies, qualification, everything we have uploaded in our website and in our previous videos also. Those who didn't watch those videos, we can go through that. And to crack the NIMHANS nursing officer recruitment examination, so we have already started a series, and this video is the fourth set of questions, fourth series in our NIMHANS series. And you know that NIMHANS is a hospital which is a super specialty hospital, especially treating patients with neurological and psychiatric disorders. So we can expect more questions from these areas. So this set of questions what I am going to explain to you today are taken from these areas. Majority will be taken from these areas, and we are going in depth regarding these topics. Okay, so the video may be little lengthy for you, but the questions and the explanations what I have given for the each questions will definitely help you to prepare well for the NIMHANS nursing officer examination. So without losing time, we will start our session. And before that, whoever didn't subscribe our channel, kindly subscribe and support us, and kindly enable the bell button so that you will be notified whenever we are uploading the new series. And kindly share about this platform to your nursing friends who are wishing to have a central government job in a very good environment. Okay, so without losing time, we are moving to the fourth session, fourth series in the NIMHANS series, and here comes the questions for you. Moving on to the very first question in this NIMHANS series. So the first question on the screen right now. So the first question is, you are caring for a client with a nasogastric tube, that is an NG tube, that is attached to a low suction. So your patient is at risk for which acid-base disorder? So this question is regarding an acid-base disorder for a patient with NG tube that is attached to a low suction. Okay, so it's a direct question. So the options for you are option number A, respiratory acidosis; option number B, respiratory alkalosis; option number C, metabolic acidosis; and option number D, metabolic alkalosis. So this type of question, especially from the acid-base balance, we can expect at least one question in almost all competitive examinations, and that questions may be direct question or indirect questions, and sometimes applicable questions like this question. Okay, so here the question is regarding the nasogastric tube with low suction and acid-base balance. So what is the answer? So the answer is option number D, that is metabolic alkalosis. Metabolic alkalosis. So we'll have a small discussion regarding the explanation of this question. So loss of gastric fluid via nasogastric suction or vomiting causes metabolic alkalosis. So this is very important. So in the question we have noted that the nasogastric tube is attached to a low suction. So there will be loss of gastric acid fluid. So here it is happening through the suction or by vomiting. It can result in metabolic alkalosis as a result of the loss of hydrochloric acid, that is a gastric secretion. Then a client receiving the nasogastric suction loses the hydrochloric acid will directly identifying an alkalotic condition. Okay, so the acid has gone, so that is directing us to the alkalotic condition. Okay, so I think with that we can identify which acid-base imbalance is happening. Okay, so coming to the second question in this series, which among the following is not comes under intentional torts? Okay, so this is from the fundamentals of nursing. So you know regarding the what is a tort, what is intentional, what is unintentional, those things are there that I'll be explaining now. So the question is regarding which is not coming under intentional tort. So the options for you are option number A, assault; option number B, malpractice; option number C, fraud; and option number D, battery. So once again, so this is another pattern of question that you can expect in almost all competitive examinations, especially in NIMHANS examinations. The thing is like regarding from the tort, and like these questions can also be expected in competitive exams. So what is the answer for this question? So the answer for this question is option number B, that is malpractice. So you'll be confused with some terms in this. So we will have a small explanation regarding this question. So first of all, we will see what is a tort. What is a tort? So a tort is a civil wrong that causes a claimant to suffer loss or harm resulting in legal liability for the person who commits the tortious act. So it is a civil wrong act which is carried out by in the hospital settings, it is carried out by a healthcare professional to a person. That the person here in the hospital setting, it will be a patient. Okay, so that is a civil wrong act that is done by a healthcare worker to a patient. Okay, so that is a tort. So in simple words, in our settings. Okay, so what is we can divide the tort into two as intentional tort and unintentional, non-intentional tort. So first of all, an intentional tort occurs when someone makes a purposeful choice to act or fail to act in a certain way. Okay, so as the name indicates, it is intentional, that is, it makes the purposeful choice. So the examples for the intentional tort are assault, then defamation, fraud, invasion of privacy, those things. So I am not going to explain all those things because you can refer it later. These are very, very, very important. Okay, so this is regarding the intentional tort. Then we can say I'll give a small explanation regarding these things. That assault, it is any intentional threat to bring about harmful or offensive conduct. So as the name indicates, assault means harmful or offensive conduct, that is intentional, and no actual contact is necessary for to become a assault. Okay, so that is important. Then another thing was the battery. So what is a battery? Battery, it is any intentional touching without consent. Okay, so this is very, very important. Any intentional touching without consent is termed as battery. So the contact can be harmful to the client and can cause injury, or it can be merely offensive to the client's personal dignity. Okay, so without the consent, if you are touching the patient, that can be termed as battery. Okay, that can be harmful in any ways, physically, mentally, whatever it is. Okay, so that is battery. Then going to the next option, that is a fraud. What is a fraud? It's a purposeful false presentation of facts to create deception, which includes presenting false credentials for employment, etc. So in hospital settings, we can tell like sometimes giving false reassurances, sometimes giving the fraud assurances and the fraud communications with the patient. Those things can be considered as fraud. So this is also a purposeful false presentation. Okay, so coming to the next type of tort, that is an unintentional tort. So an unintentional tort, it is a type of unintended accident that leads to injury, property damage, or financial loss. So as the name indicates, it is unintentional and it can lead to injury to the patient or to the property damage of the hospital, or financial loss either to the patient or to the patient relatives or to the hospital, like that, etc. Okay, so that is unintentional tort. So in that, the two terms that is very, very important is negligence and malpractice. So what is the difference between negligence and malpractice? So what is a negligence? Negligence, it means it is an act or conduct that falls below the standard of care. Okay, so here the care has been given, but that was the below the standard of care. So it involves exposure of patients, so it involves exposure of person or property of another to unreasonable risk for injury by acts of commission. That means inappropriate actions. Here there is an action happened that is not appropriate to the situation, or a commission, that is a lack of appropriate action. Okay, so that is known as the negligence. Here some sort of action is happened, but that is not appropriate to that situation. Okay, so I'm giving you a work, like if you are free, you can put some examples for negligence and malpractice for better understanding. Okay, so what is a malpractice? So malpractice, it is a negligence or carelessness. Okay, carelessness by a professional person. Okay, it is a negligence or carelessness by a professional person. Any unreasonable lack of skill in professional duties or immoral conduct that results in injury to or death of the client. So that is known as the malpractice. Okay, so I think you got the difference between negligence and malpractice. So that's all regarding that question. So it was very, very important. So further you can read about this topic and you can prepare well for the exam. Okay, so moving on to the next question, that is the third question in this series. So the question is, how a nurse will have to collect urine sample for culture from urinary collecting system. So for the urine culture, how the specimen will be collected from a person who are having urinary collecting system. That means indwelling urinary catheters. That means Foley's catheters. That is the question. So the options are option number A, with needle aspiration. Option number B, empty urine from the bag. Option number C, collect from catheter. And option number D, disconnect the bag and catheter. Disconnect the bag and catheter. So how you will connect the urine sample for culture? So for the conscious patient, we know that we have to collect the midstream urine. So for unconscious patient or patients having urinary collecting systems like Foley's catheter or indwelling catheters, so how we will collect the sample? So you know, this is a very simple, very easy question, and the answer for this question is obviously option number A, that is with needle aspiration. So with needle aspiration. So we will have a look on the explanation of this question. So the process of obtaining a sample of urine from a patient with an indwelling urinary catheter must be obtained from the sampling port, and the sample must be obtained using an aseptic needle. Okay, aseptic needle, through needle aspiration only we can take the sample. Okay, so that is a practical based question that we can expect in this examinations. So now we can move on to the fourth question in our series. So the question is from the GI system, which among the following would immediately alert the nurse that the patient has bleeding from the GI tract? So this is regarding the internal bleeding, internal GI bleeding, and how a nurse will be alerted regarding the internal GI bleeding. That is the question. And the options for you are option number A, complete blood count. Option number B, Guaic test. Option number C, vital signs. And option number D, abdominal girth. So the key point that I'll tell you for a hint in this question, the key point is immediately. Immediately. So what is the answer? So the answer for this question is option number B, that is the Guaic test. Okay. So Guaic test is a very simple thing that I will be explaining now. So to assess for the GI tract bleeding, when frank blood is absent, then test for the occult blood. Okay, test for occult blood or the OB in the vomitus if present or in the stool through Guaic test. So Guaic test is otherwise known as the occult blood testing in the stool. So that test is otherwise known as the heme occult test. Okay, heme occult test. So how this test can be done and what is the procedure involved in it, I will be explaining now. So the stool Guaic test or the Guaic fecal occult blood test, it is one of the several methods that detects the presence of fecal occult blood. Occult blood means the blood that is invisible in the feces. So the test involves placing a fecal sample on Guaic paper. So what is a Guaic paper? Guaic paper, it is a paper that is taken from the wood resin of guaiacum tree, and it contains a chemical called a phenolic compound, alpha guaiconic acid. Okay, so this is the chemical that is found in the Guaic paper, that is alpha guaiconic acid, that is extracted from the resin of guaiacum tree. So we have to place the fecal sample and applying hydrogen peroxide, which in the presence of the blood yields a blue reaction product within seconds. So within seconds we will get a blue reaction product if we are placing the stool sample on the Guaic paper and after adding the hydrogen peroxide solution. Okay, so this is the stool Guaic test or the stool fecal occult blood testing. Okay, So in the question we have mentioned like immediately we can detect by this method. So the other methods, other options we can omit very easily, because we know that a complete blood count does not produce an immediate results, and it does not always immediately reflect the blood loss. Obviously that changes will happen later, but immediate reflection is not possible. We won't get an adequate information from the complete blood count. And vital signs, obviously the changes in the vital signs may be caused by the factors other than the blood loss will be there, and abdominal girth is unrelated to the blood loss in the GI tract. Okay, so in this way we can omit the other options and we can come to the answer, that is a Guide test. So that's all regarding the fourth very informative question. So we will move on to the fifth question in this series. So the question is in the screen right now. Which of the following nursing interventions should you use to prevent food drop and contractures in a patient recovering from a subdural hematoma? So this question is regarding preventing the complications in a patient after subdural hematoma, that is the food drop and contractures. Okay, so that is the question. So the options for you are option number A, high top sneakers; option number B, low dose heparin therapy; option number C, physical therapy consultation; and option number D, sequential compressive devices. So you should read the question very carefully. So slight confusion can happen in this question. The question is regarding preventing food drop and contractures. Okay, and you have to select the most appropriate answer from this question. So what is the answer? Food drop and contractures prevention. So the option number A, high top sneakers, is the answer for this question. So you know that the other options like low dose heparin therapy, sequential compressive devices, all these things are there for the prevention of DVT. So that we will have an explanation now. So the high top sneaker or the high top shoe, it is a shoe that extends slightly over the wearer's ankle. So high top sneakers are used to prevent food drop and contractures in patients with neurological conditions, especially after the surgery and all. Okay, so the other options, that is the intermittent pneumatic compression or IPC devices, are the inflatable sleeves that prevent the blood clots. Okay, so these things are there to prevent the DVT, that is another complication of immobility. Then sequential compressive device, that is also a method of DVT prevention that improves the blood flow in the legs. Okay, so these are the methods to prevent DVT. And low dose heparin also, you know, that is a method of prevention of DVT. And physical therapy, that is physical therapy consultation, is important for bedridden patients. But while we seeing the options, the most important thing what we can give is option number A, that is for providing a sneakers. Okay, so now we will move on to the sixth question in our series. So the sixth question is in the screen right now. So the sixth question, which activity is at the greatest risk for a shearing force injury to the skin? So greatest risk for a shearing force injury to the skin. So what is a shearing force injury? What is a friction force injury? These are the things that you have to understand while preparing for the examination, especially from the bedsore part of view. Okay, so the options are option number A, walking without shoes; option number B, sitting in Fowler's position; option number C, lying supine in the bed; and option number D, using a heating pad. So which can cause a shearing force injury? So the answer is option number B, that is sitting in Fowler's position. So what is a shearing force injury, that we will have a look. So shearing wound occur when forces are applied to body tissues or parts that cause these tissues to move in opposite direction. So shearing forces can put pressure on the blood vessels, causing them to be closed off, resulting in reduced blood flow to an area. So this is the simplest example, simplest explanation of a shearing wound. So then forces are applied to the body tissues or the parts that cause these tissues to move in opposite direction. Okay, so some sort of shearing is happening, that is a shearing wound. So we know that unlike the shear injury, friction injury will be visible. So the shearing injury is not visible, but the friction injury will be visible. Friction is the mechanical force that is exerted when the skin is dragged across a cool surface such as the bed linens. For example, if the patient is lying down in the supine position and if you are removing the cloth or the linen from the patient, there will be course that mechanical force we are exerting over the skin, and there will be a visible damage of the skin can happen. So that is an example for the friction force, and the shearing force also already we have explained. Okay, so I think you got the difference between friction force and the shearing mechanical force. So the none of the other movements or the situations creates the combination of friction and pressure with downward movement, which is seen in the bedridden clients positioned in the Fowler's position. So in the Fowler's position, shearing force is happening, and there will be non-visible damage can happen by occluding the blood vessels if the patient is kept in the Fowler's position for a long period of time, especially bedridden patients. Okay, so that is a very important tricky type of question, but you should understand what is the difference between shearing force injury and the friction force injury. Okay, I think that question also is clear for you. Now we can see the seventh question in the series. The question is bit large but very important. On assessment of a patient with congestive heart failure, the nurse notes that the client is dyspneic and rails are audible on auscultation. What additional signs would the nurse expect to note in this client if fluid volume excess is present? So here the question is from the cardiovascular system. So the patient is with the congestive heart failure, and the presenting features or clinical symptoms are dyspnea and rales. Okay. So what additional symptoms can be expected in this patient? And an important key point in this question is fluid volume excess. So from this question you should understand in what condition the patient is. So whether that the patient is in the heart failure, cardiac failure, whether this is the right heart failure or the left heart failure, that you have to identify, then you can answer this question. So the very important key point what they have given in this question is the fluid volume excess. So we will go to the options of this question. A decreased CVP, that is a central venous pressure. Option number B, flat neck and hand veins. Option number B, an increase in the blood pressure. And option number D, there will be weight loss. So through the process of elimination also you can come to the answer for this question, but this is a little tricky but very informative question. Okay, so what is the answer? So the answer for this question is definitely option number C, that is an increase in the blood pressure. There will be hypertension. So we will have a little detailed explanation regarding this question. Why I am spending so much time for this question is this is very important, and from this question itself you will get so many information regarding the left heart failure and the right heart failure. So the right-sided congestive heart failure, I will explain now. So the right-sided congestive heart failure develops when the right ventricle struggles to deliver blood to the lungs, that you know very well. So as the blood backs up in the blood vessels, the body begins to retain the fluid in the abdomen and the lower body parts. So aside from this swelling, the patient may also experience shortness of breath among their symptoms. So there will be shortness of breath will be there, fluid accumulation will be there, especially in the lower part of the body, especially in the abdomen and all, because the right side of the ventricle struggles to deliver the blood to the lungs. Okay, so this is the pathophysiology for the right-sided heart failure. So coming to the left-sided heart failure, congestive heart failure, it is the most common form of congestive heart failure. So this is the most common form, that is a left-sided congestive heart failure, and it begins when the left ventricle cannot effectively pump the blood throughout the body. Okay, so eventually what will happen, this can lead to fluid retention will be there, particularly around the lungs. Okay, particularly around the lungs. So the common symptoms include swelling will be there, same like the other heart failure, there will be trouble breathing will be there, and coughing will be there. Okay, so some differences that we can explain with the help of this picture. So here we have the left heart failure, what I have explained recently. That means there will be decreased cardiac output and pulmonary congestion will be there. Decreased cardiac output will be evidenced by activity intolerance, and there will be signs of decreased tissue perfusion because enough blood is not getting pumped out of the heart. And pulmonary congestion, as a result there will be pulmonary congestion will be there. So there will be impaired gas exchange and can be visible as cyanosis and signs of hypoxia, and there will be pulmonary edema, there will be collection of the fluid and can result in orthopnea. Then cough with pink frothy sputum will be there, and paroxysmal nocturnal dyspnea will be there. So these are the key features or the key points that you have to remember regarding the left heart failure. So on contrast, on the other side, you can see the right heart failure where there will be congestion of the peripheral tissues are happening, and there will be dependent edema. That means lower limb, lower part of the body edema will be there, and fluid accumulation in the abdomen, that will be ascites will be evident, and in the liver there will be congestion which can give signs of impaired liver function, and GI tract congestion can result in the anorexia, GI distress, GI disturbances, and weight loss will be there. So these are the key differences what we can see in the right heart failure and the left heart failure. Okay, so this is a sure short question. One question from this area is a sure short question in almost all competitive examinations. Okay, so I think you got a rough idea about the left heart failure and the right heart failure. So further you have to prepare well for the next level. Okay, so the assessment findings associated with the fluid volume excess include there will be cough, dyspnea, rails, tachypnea, tachycardia, there elevated blood pressure and a bounding pulse will be there, and there will be CVP will be increased, weight gain will be there, obviously edema, neck and hand vein distension will be there, then altered level of consciousness, and there will be a decreased hematocrit. Hematocrit is RBC divided by plasma. So these are the features, okay, of heart failure what we have already explained. Okay, so that was a very informative question. Now we will move on to the 8th question in our series, and this is also a very important question. How many hours should it take for a high blood glucose level to return to normal after a GTT? So here, many of the times we have seen questions like from GTT, that is glucose tolerance test, like how many grams are giving, how frequency, what is the frequency of the test, and for which all conditions we are doing. Those questions we have seen several times in several competitive examinations. So this question is regarding how much time it will take the blood sugar to come to normal after a GTT. Okay, so GTT should not be confused with the GGT. GGT is another test, and you can comment it later what is GGT. Okay, so this is regarding the GTT, and the options are option number A 2 hours, option number B 3 hours, option number C 5 hours, and option number D 6 hours. So how much time it will take the blood glucose level to become normal after a GTT? So what is the answer? So the answer is option number B, that is 3 hours. 3 hours it will take to normal. So what is a GTT? That the glucose tolerance test. It is performed to measure the body's response to glucose. So in this test, a sugary solution of 75 grams. This is the practice what is practicing in India. Some countries they are using 50 grams, and for the children the value will be titrated. Okay, so 75 grams of sugary solution is given, and sugar levels are measured 1, 2 and 3 hours post the ingestion of the sugar solution. So the test is also useful in screening for the type 2 diabetes and diagnose the pre-diabetes and gestational diabetes. Okay, in our settings usually for the gestational diabetes they are using this GTT. Okay, and the question was the blood glucose level should remain to normal within 3 hours, and some sort of hypoglycemia within this time can be expected without causing any problems. Okay, so that was the question, and the answer for that question, that is, I think that is a good information for you. Now we will move on to the 9th question in the series. A simple one word question. Mitral cells are present in dash, where we can find mitral cells. So to confuse you, I have some options. The option number A, mitral valve, option number B, kidney, option number C, optic nerve, option number D, olfactory tract. So where you can see mitral cells. So it is not in mitral valve, so it is in where it can be seen in the olfactory tract. Okay, olfactory tract. So we'll have a small explanation. So what is a mitral cell? Mitral cells are neurons that are part of the olfactory system. So they are located in the olfactory bulb in the mammalian central nervous system, olfactory bulb. So they receive information from the axons of the olfactory receptor neurons, and it forms the synapses, which is called as glomeruli. So glomerulus is there in the nephrons also, don't be confused. So axon of the mitral cells transfer information to a number of areas in the brain, including the piriform cortex, then the anterenal cortex and amygdala. Okay, so in these areas they have number of these axons of the mitral cells we used to transfer the information to these areas. Okay, so mitral cells in the olfactory system. Okay, so that's all regarding that question. Now we will move on to the 10th question of the series. So according to which therapy all humans' core beliefs can be summed up in three categories, that is yourself, others and future. So this question is from the psychology. So especially for the NIMHANS examination, some certain percentage of questions we can expect from even psychology also. Psychology, psychiatry, neurology. Okay, so this is from the psychology, and this is regarding a therapy that we are very commonly what we are using in the psychiatric setting. So according to which therapy all humans' core beliefs are summed up in three categories, that is yourself, others and future. So the options are option number A, cognitive behavioral therapy, option number B, psychotherapy, option number C, brief therapy, and option number D, person-centered therapy. So what is the answer? So the answer for this question is option number A, that is a cognitive behavioral therapy. So what is a cognitive behavioral therapy? So cognitive behavioral therapy is a psychosocial intervention that aims to reduce the symptoms of various mental health conditions, primarily depression and anxiety disorders. Okay, so this picture you have to keep in your mind. So here we can see a triangle that is in the center. These are considered as the core beliefs, okay, humans core beliefs, and it is summed up into three categories, like that is one is self, that is yourself, then the next comes the others, and the final one is the future. So these our core beliefs are summed up in these three areas. Okay, so that is the question what I have asked. And regarding the other options, so before that, regarding the cognitive behavioral therapy, we know that it with the conscious interaction of the patient, the psychotherapist or the therapist used to collect the information and giving some responses that can help the patient in identifying their problems and to come out of those problems. Okay, so the patient will be conscious, and what the patient is telling, based upon that the therapist will understand the issues or the problems, and the solutions will be explained. So that is a cognitive behavioral therapy, and it is different from other therapies. Okay, so what is a person-centered therapy? Person-centered therapy is also known as the client-centered, which focus on the therapist showing openness, empathy and unconditional positive regard to help the client express and develop their own self. Okay, so that is a person-centered therapy. Then what is a short-term and long-term therapy? So therapies are sometimes classified according to their duration. So a small number of sessions over a few weeks of period or months may be classified as the brief therapy or short-term therapy, and on the other hand, some regular sessions will take place for years, and that may be classified as the long-term therapy. So this is as per the duration. Based on the duration, these therapy sessions can be divided into long-term and short-term. Okay, then comes the group psychotherapy or the group therapy. It is a form of psychotherapy in which one or more therapists treat a small group of clients together as a group. Okay, so here therapist will be more than one, and there will be number of clients will be there, a group of clients will be there. So that is a group psychotherapy. So the answer for our question is cognitive behavioral therapy. That triangle picture you please keep in mind. Okay, So that's all regarding the 10th question. Now we can see the 11th question in our series. So this is from the pediatric neurology. Global developmental delay can be diagnosed when a child is delayed in how many milestones? So we know that milestones are the periods of achievements of certain skills by the kids when they are growing. So when we can term a child is having global developmental delay. So that is a question for you, and the options are option number A, one or more delay in milestones, option number B, two or more, option number three or more, and option number D, none of the above. So what is the answer? So when we can diagnose a child as having global developmental delay? So what is the answer? Answer is obviously option number A, that is one or more. So we know that we'll have a small definition of the global developmental delay. Global developmental delay, it is an umbrella term which is used when children are significantly delayed in their cognitive, physical development. Okay, cognitive and physical development, and it can be diagnosed when a child is delayed in one or more milestones, which is categorized into motor skills, speech, cognitive skills, social and emotional development, etc. Okay, so this is a brief explanation regarding the global developmental delay. Okay, so the delay can be visible in their motor skills, speech, cognitive skills, social and emotional development, etc. Okay. So that's all regarding the 11th question in our series. Now we will see the 12th very important question from the central nervous system, and the question is Uchthof's phenomena and Pulfrich effects are associated with which neurological condition? So here the question is regarding the neurological condition where we can see Uchthof's phenomena and Pulfrich effects. Okay, so the options for you are option number A, epilepsy, option number B, encephalitis, option number C, optic neuritis, and option number D, myelitis. So just think about some demyelination disorders, then demyelination autoimmune disease disorders, then you can come to the answer for this question. Anyway, whatever it is, you have to understand regarding what is Uchthof's phenomena and Pulfrich effect. So first of all, we'll see the answer for this question. That is, the answer is option number C, that is optic neuritis. And if you have another option in this question like multiple sclerosis, then that also will become an answer. Okay, so why means that I'll be explaining now. First of all, we will see optic neuritis. So what is an optic neuritis? It describes any condition that causes inflammation of the optic nerve, and it may be associated with demyelinating diseases or infectious or inflammatory processes. Okay, so that is optic neuritis. And when you are referring optic neuritis, there are so many terms which are associated with optic neuritis, optic bulbar disorder, like that. So many terms are there that you can refer later, because in NIMHANS examinations these points are very important. Okay, so then first we will see what is a Pulfrich effect. So what is a Pulfrich effect? It is a psychophysical percept wherein lateral motion of an object in the field of view is interpreted by the visual cortex as having a depth component due to a relative difference in the signal timings between the two eyes. So in simple, I can explain like if the lateral movement is happening in front of the two eyes, so two objects will be there, but the patients may feel like there is that difference, there is a depth between these two objects, because the signaling timings are different. Relative difference will be there in the signaling timings in these patients in their two eyes. Okay, so that is the Pulfrich effects. That movement of the object will be in the same plane and in the same direction, that is in the lateral direction, but the patients can feel there is a depth from one point to another because of the relative difference in the signaling timings. Okay, so that is a Pulfrich effect. So this can be seen in optic neuritis. And what is the Uchthof's phenomena? Uchthof's phenomena, it is the worsening of the neurological symptoms in optic neuritis and multiple sclerosis and other demyelinating diseases when the body is overheated. That means when the body temperature increases, there will be worsening of the neurological symptoms, which can be seen in optic neuritis or multiple sclerosis or any other demyelinating disorders. Okay, so that is the Uchthof's phenomena. So from this question, you are learning about two phenomena. There is a Pulfrich effect, Uchthof's phenomena, optic neuritis, multiple sclerosis. Okay. So then myelitis. What is myelitis? We will see the other options also, but myelitis, it is extremely different. So it is an inflammation of the spinal cord which can disrupt the normal responses from the brain to the rest of the body and from the rest of the body to the brain. Okay, so that is a myelitis. So that is unrelated to the question what I have asked. Okay, so from that question you are getting again many information regarding these two effects and phenomena. Now we can see the 13th question. So here the question is from the obstetrics and gynecology. Okay, so the question is, disseminated intravascular coagulation is one of the major complications of which among the following. So here the question is regarding the DIC, and the options what we are going to see, all options are from the gynecological conditions, obstetrical conditions. Okay, so based on that you have to answer the question. So option number A, abruptio placenta at the venous end. Option number B, placenta previa. Option number C, abruptio placenta at the arterial end. And option number D, all the above. So you have to learn regarding the conditions and the obstetrical conditions where disseminated intravascular coagulation can happen as a complication. Okay, so then only you can answer this question easily. So here it is slightly confusing, so I can explain you very well in the explanation session of this question. So first of all we will see the answer for this question, and the answer is option number C, that is abruptio placenta at the arterial end. Okay, so definitely abruptio placenta is the answer, and to confuse you, so these options were given. Okay, so definitely you will have a doubt like whether in the placenta previa also disseminated intravascular coagulation can happen or not. So we will have an explanation for this question. So what is a placental abruption? A placental abruption caused by arterial bleeding at the center of the placenta leads to sudden development of severe symptoms, and life-threatening conditions include fetal heart rate abnormalities, severe maternal hemorrhage, and DIC, that is disseminated intravascular coagulation. So this can happen in the abruptio placenta, which is happening in the arteries, arterial bleeding. So that's why arterial end bleeding of the abruptio placenta is a cause for disseminated intravascular coagulation. Okay, so why means the bleeding will be heavy. So those abrasions which are caused by the venous bleeding at the periphery of the placenta develop more slowly. Okay, so in the arterial end means it will be in the center of the placenta and the bleeding will be very rapid, but in the venous bleeding it will be in the periphery and it will develop very slowly and can cause small amounts of bleeding, intrauterine growth restriction, and oligohydramnios. Okay, so from these two paragraphs I have given some information regarding the clinical features what we can see in arterial abruptio placenta bleeding and the venous abruptio placenta bleeding. So some more information I'll pass to you. So DIC is always secondary, which can happen secondary to an underlying disorder, and indeed it is associated with pregnancy complications such as placental abruption, already we have explained, then HELP syndrome, preeclampsia, retained stillbirth, then sepsis, postpartum hemorrhage or PPH, then acute fatty liver, and amniotic fluid embolism. So you should by heart these conditions, and these conditions are the conditions where disseminated intravascular coagulation can happen as a complication in obstetrics and gynecological conditions. Okay, so this is very important. And why in placenta previa we are not getting? So in 1%, okay, 1% of the patients are getting DIC from placenta previa, that is secondary to the hemorrhagic stroke. Okay, not related to that placenta previa. So that's why we are not keeping all the above as the answer for this question. So I think you got the point. Okay, now we will move on to the second last question in our series, again from the central nervous system. So the question is, which among the following suggestive of autonomic dysreflexia? So autonomic dysreflexia, another very important life-threatening emergency, neurological emergency. So the options are option number A, elevation of 20 millimeter mercury over the baseline systolic BP below the level of injury. So options are little lengthy, and I kept these options because you should learn very pakka regarding the autonomic dysreflexia, because this is that much important. And option number B, depletion or decrease in the 40 millimeter mercury over the baseline systolic BP, which can happen below the level of injury. Then option number C, depletion of 20 millimeter mercury over the baseline systolic BP, above the level of injury, and final option, elevation of 40 millimeter mercury over the baseline systolic BP above the level of injury. So here the options are very confusing. So first of all, you have to understand what is autonomic dysreflexia, what is the clinical features of the autonomic dysreflexia, then where it can happen, whether it is happening below the level of injury or above the level of injury. These things you have to know to answer this question. So what is the answer? So the answer for this question is option number A, that is the elevation of 20 millimeter mercury over the baseline systolic BP below the level of injury. So we will have an explanation regarding the autonomic dysreflexia or AD. So it is a potentially fatal medical emergency classically characterized by uncontrolled hypertension and cardiac arrhythmias. Okay, so uncontrolled hypertension, cardiac arrhythmias. So it occurs most often in individuals with spinal cord injuries with lesion at or above the T6 spinal cord level, and although it has been reported in patients with lesions as low as T10. So T10 most commonly in the T6 level and sometimes as low as T10 level, which is characterized by uncontrolled hypertension and cardiac arrhythmias, and it is a medical emergency. Okay, so an elevation of 20 millimeter mercury over the baseline systolic BP with a potential source below the neurological level of injury, below the neurological level, that means below T6 level or the T10 level, meets the current definition of dysreflexia. So this is very important, underlined as very important topic. So you have to learn furthermore regarding what is autonomic dysreflexia and the clinical management. Okay, so that I'm not going in depth, so we have very limited time. So we are moving to the last question in the series from the GIT, and the question is, lactulose is prescribed for the patients with hepatic encephalopathy to dash. So what is the use of lactulose? What is the benefits of lactulose? Use of lactulose in hepatic encephalopathy. So that is the question, and the options are: option number A, decrease the bilirubin level; option number B, decrease the serum ammonia level; option number C, increase the protein level; and option number D, increase the ammonia level. So think about the hepatic encephalopathy, how it is happening, and how lactulose will help in decreasing or increasing whatever it is. So what is the answer? So the answer is obviously option number B, that is decrease the serum ammonia level. Okay, so we know that hepatic encephalopathy, it is a reversible impairment of the neuropsychiatric function, and it is caused by toxins such as ammonia that accumulates in the blood when the liver is unable to filter them out. Okay, so the toxins can then travel to the brain and temporarily or permanently affect the brain function. Okay, so that is encephalopathy. So elevated concentrations of the ammonia in the brain can lead to a spectrum of neuropsychiatric and neurological symptoms. I am not going to the in-depth regarding this. So lactulose, how it will help is like lactulose and lactitol, they are thought to decrease the generation of ammonia by the bacteria. So ammonia generation by the bacteria will be cut off, and it render the ammonia inabsorbable by converting it into ammonium, okay, from NH3 to NH4, and increase the transit of the bowel content through the gout. So this is the mechanism by which the lactulose is reducing the ammonia level. So the dose is usually 15 to 30 ml administered 3 times a day, and the result is aimed to be 3 to 4 soft stools a day. Okay, so this is the goal of the treatment. So we have explained about the use, how it is acting, then dose 15 to 30 ml TID. Then our goal is to get 3 to 5 soft stools in a day. So lactulose may also be given by enema, especially if the encephalopathy is very severe, and most commonly phosphate enemas are used. Okay, so this is in short regarding the lactulose and its uses in the hepatic encephalopathy. So this question also was very informative. So with this informative question, we are coming to the end of these sessions. So these 15 questions, which are taken from different aspects, especially from the neurology, are very important if you are aiming to get a seat in the NIMHANS entrance exam, NIMHANS competitive examination. So once again, best of luck for the upcoming examination. Keep in touch with us, and keep in touch with us to get updates regarding our examination, and we will be coming back with the next videos very shortly. So see you soon. Till that time, signing off. Thank you.